To kick off our session, it's my pleasure to welcome Sean Graglia, lead marketing consultant at Alencia XR, who will guide us through today's session. Over to you, Sean.
Thanks, Adam. As Adam mentioned, I lead the marketing for Alencia XR and HoloAnatomy. It's a pleasure to be with you today. I'll start by thanking everyone for taking time out of your busy day and joining us to explore the advances that we're seeing in neuroanatomy and anatomy education. And particularly, I want to welcome our friends from the American Association for Anatomy that we love so much. So thank you. You know, when our first webcast that you may have attended, you heard a little bit about the story of the how and why on the HoloAnatomy learning platform and how it's evolved to reimagine gross anatomy education and neuroanatomy. And that solution is being experienced and driving impact across multiple organizations and institutions. So today, we're going to explore deeper into how this technology is affecting neuroanatomy at KansasCom with our special guest. So let's go over the agenda first, and then we'll dive in. And we'll just advance to the next slide and going over the agenda. So the goal here is to share the learnings directly from a leading voice on neuroanatomy education with you so that you can develop an understanding of what the potential could be for your institution or your organization. You could be realizing similar benefits that you'll see today. So in order to do that, first, I wanted to start with talking a little bit of the context of how this type of education is being reimagined with XR technology. Then we'll go with my special guests and hear the story of how neuroanatomy is being reimagined at Kansas College of Osteopathic Medicine. Then we'll spend some time doing a Q&A. We can ask any questions directly to the team or Dr. Jeter. And we'll end with a few tips on getting started for yourselves and leave you with something you can actually build on. So in order to give a little bit of context for today, I wanted to give you a little bit of the story behind how anatomy and neuroanatomy education is already being reimagined with XR. And so when we look at how this was approached at Case Western Reserve University, it was actually an academic necessity that they build and rethink how they're doing their education. There wasn't an opportunity to actually have a cadaver lab in their new facility. And so they took that as an opportunity to step back and think, how can we use technology, the latest technology, to address critical requirements to really achieve excellence in anatomy and neuroanatomy education? And so when we look at that, they came up with really three things that were critical that they had to address in the solution. The first, that it had to have the level of detail absolutely required in anatomy and neuroanatomy. In particular, in neuroanatomy, they needed to make the invisible visible so that everyone could understand the spatial relations between everything. The next thing they had to make sure of is that the curriculum could be tailored and the solution could be delivering exactly what they needed it to do based on their existing curriculum. And that flexibility is very important. The third thing that was very important is they had to enable students not just to learn individually, but to collaborate with each other, to see what other people are learning and to see and experience together. So with those three things in mind, they looked at all the technology available, and there really wasn't anything, but there was emerging XR technologies being experienced right from middle school all the way up. It's becoming an expectation, and they created two different suites. At first, the HoloAnatomy suite was developed for gross anatomy, and then they expanded and really wanted to take those advancements and learnings into neuroanatomy. And Alencia XR was proud to recently have a general release of HoloAnatomy Neuro Suite. And that's where we're actually going to spend some time and hear from my valued guest, who I'll now introduce. I'm really fortunate in my role and my career to come across people that inspire me. And that's exactly what Dr. Cameron Jeter has done since our first initial meeting back at Connected Anatomy. It's my pleasure to introduce Dr. Cameron Jeter, professor and chair of the Department of Biomedical Sciences at Kansas College of Osteopathic Medicine. Dr. Cameron has a PhD in neuroscience and is pioneering in the use of HoloAnatomy Neuro Suite at KansasCom. And so today she's going to share how this cutting edge technology is actually transforming neuroanatomy for the better learning education over at KansasCom. Over to you, Dr. Jeter.
Thank you, Sean, and welcome everyone. As he mentioned, I am faculty at the new Kansas College of Osteopathic Medicine. We are a school that has existed now with students for 3 years, and that means that our anatomy education has evolved over 3 years. I specifically today, with excitement, want to tell you how we have integrated the HoloAnatomy Neuro Suite into our neuroanatomy curriculum. And because this is a course for second-year medical students, we've been able to have 2 iterations of how we have done that together. The outline for how I'm going to share our time together includes letting you know a little bit about the first software suite from Alexia XR, namely the HoloAnatomy suite. And then I'll go into a bit about the logistics of how we at KansasCom have brought about 4 different neuroanatomy lab sessions involving the HoloAnatomy Neuro Suite. And then, of course, at the end, as you'll learn about me, I love to have fun and teach in memorable ways, because that is what the brain remembers best, is integrating across disciplines, including metaphors, songs, and games that you'll see. Before we get too far, I do want to let you know I have no conflicts of interest to disclose. So as promised, I first want to introduce the concept of HoloAnatomy software suite. KansasCom, my school, also has this software in addition to the neuroanatomy software. Shown here on the screen are a series of educational research articles that over the past 5 years or so have underscored the utility of using HoloAnatomy software in education. And this has been done either in conjunction with educational systems that have donors, that is cadaver dissection as part of their program, and programs like ours that do not have donors, that use instead a variety of technological tools to teach anatomy. And for those that are unfamiliar with HoloAnatomy software and the hardware that goes with it, I'm indicating that in the picture to the right. You'll see students wearing headsets, and they are looking on the floor and rising from the floor to see a hologram that has been designed in advance of this laboratory session. So as the faculty member and with my staff team, I can designate that I want the skeleton to be the hologram, and specifically to differentiate between the appendicular and axial skeletons with the colors of purple and yellow. We'll talk more about that to come. A bit about where my university is. KansasCom is located in the center of the country in Wichita, Kansas. And so it is a great pleasure to be at the heart of the country and at the heart of advancement in anatomy education. You'll notice that we have created, as I said, 4 laboratory sessions that employed HoloAnatomy Neuro software. And I'll be able to show you some of the holograms that we have used for each of these 4 topics. Introduction to the central nervous system that appeared at the beginning of the laboratory course, learning the motor and sensory pathways. These are those long axons, either ascending or descending the spinal cord, to tell our brain about the environment around us, and likewise command the muscles to interact with our environment. And then lastly, learning about the cranial nerves and their brainstem nuclei. This by no means is the limit of the topics that can be taught with neuroanatomy and the HoloAnatomy platform, but this is where we have started in our early nascent program. So this is the logistics or the timeline that faculty proceed through to prepare each neuroanatomy lab. You'll notice that to be fun, I've come up with the letter D to start each name of the phases, that before the laboratory session begins, the team designs, in a sense, the curricular design for what the holograms will be. The students, with the push of a button, and this is a virtual button in the air, during lab can advance through a series of holograms. During this design phase, I, as the faculty member, am deciding what are those holograms that I want the students to view? And do I want the structures that they view to be opaque or transparent? Do I want them to be all one color or a rainbow of colors to distinguish perhaps function or group? These are the sort of curricular design questions that I ask myself. This is not done in isolation. I sometimes confer with other faculty and then communicate the design to Shaquela Willett, our very capable medical education support specialist. And so I am fortunate at Kansas Com to have a variety of support staff that help me along the way creating each laboratory session. Once we reach the laboratory session, there are 3 steps during the lab. Students first don their headsets. They detect the right software file to pull up the holograms that are prepared for them that day. And thirdly, the bulk of the lab session is discovering together the neuroanatomical concepts that are at front and center that week. The audiovisual team at Kansas Com helps me with this. So on the media team is Adam Bontrager, Taryn Barnes, and Kevin West. The 3 of these gentlemen help prepare the lab in advance. For example, keeping hardware and software up to date, making sure that they are connected to the Wi-Fi in the room, that they are plugged in and charged. These sort of logistical measures are taken care of by this very capable AV team. 1 or more of these gentlemen also attend the laboratory session with me, just in case students have questions about the hardware or software part of learning. That way it takes away this possible distraction or cognitive load on the student. They don't have to be an expert in the technology, which is very simple to use anyway, just putting on the headset. But if it should drop out of Wi-Fi, for example, this staff is on hand to help. So let's now begin at the design phase. What might you do as faculty or the preparation team in advance of lab? Well, we use the HoloAnatomy Neuro Designer. The designer phase is where we are telling the software program, this is what we want you to project so that learners can visualize during the laboratory session. As I've indicated before, each slide is a hologram. And notice that on the left-hand panel, it shows me how many slides I've created in the slide deck. Here, this file thus far only contains 1 slide. I can copy the slide to continue to add other aspects to it that will populate down the column, or start afresh and new building the hologram. The menu on the far right is the check boxes that allows me to indicate what structures to visualize on this specific slide. For example, you'll see that I've chosen the cerebrum with the cerebellum at the back, cross sections of the brainstem, as well as cross sections of the spinal cord all the way down to the caudal end of the cord. There are many different options as you build. As I mentioned, either having structures to be opaque or transparent so you can see deeper structures within, or to change the color, or to add labels, either labeling with the name of the structure, like cerebellum, or labeling with a letter, like A. This allows then the students during class, almost like a practical exam, to fill out that A is the cerebellum. This file is shareable in the cloud so that, for example, my staff, Shaquela Willett, and I can work together on this aspect of designing the course. Now we've moved to the laboratory session, and we're going to work our way through the 3 steps of donning the headset, detecting the software file, and then discovering as a team the neuroanatomy of that laboratory session. So notice the students here in the center of the screen that have donned their headset. I love these particular headsets and headsets in general that are untethered. That means they don't have a cord that limits your radius that you can move around to see the hologram. They're adjustable to the head size. They also work with glasses, someone who wears eyeglasses, and very scalable. What I mean by this, as a new school, our entering class was 90 students. The way we divided them by anatomy hour meant that I had approximately 22 students with me for the neuroanatomy exercise with the HoloAnatomy software. Very quickly now, in just 2 years additional time, our freshman class is a size of 200 students, more than double in just those 2 years. Once again, because we have the right number of headsets, I can accommodate now a lab session hour of 50 students. These other pictures on the screen are indicating how we do that in our anatomy laboratory space. The bottom right-hand photo is showing our large anatomical lab. And I want you to notice that on the carpet has been taped with blue painter's tape, 10-foot by 10-foot squares that we call a pod. On the left is a better picture showing the 10-foot by 10-foot pod. And a few orange X's in each pod help us calibrate the headset to this geographic location on the floor. The headset also can scan a QR code on the ceiling. All of this is telling the headset, here in this pod is where the hologram will appear. Because all headsets are calibrated together, it means students can easily don whichever headset they wish and report to any pod in the room, and they will then join a session that is the detect step, where they are making sure that they see the same hologram as the peers in their pod. Now, you may want to, as an instructor, use every minute of the lab session, but if this is students' first time experiencing the HoloAnatomy Neuro Suite, you've got to wait for the wow factor. This is otherworldly to experience augmented reality. It is you and the hologram being able to look face to face with a 6-foot-tall hologram. And I should add, you can even scale the size of this hologram to be 75%, 100%, or even 150 or 200% size as you scale the anatomy. Notice that in the background, we can also insert almost PowerPoint size or PNG files of additional information to help augment what students are learning via the hologram. This has given great fun to all the students and visitors that have come through Anatomy Lab. Here, 2 students are standing in the anatomical position with their hands and palms facing forward as they learn that this is the standard anatomical position by which we link the anatomical terminology of anterior, posterior, and the like. These students are even getting more familiar with the hologram, learning that once they lean into and bring the visor into the hologram, it peels away the outer layers, showing students what the deeper structures would look like. We'll see that in more detail when I cover the content of Lab 1, Introduction to the Central Nervous System. But look how fun it is for these students who have become familiar, comfortable. They're now laughing and even laying on the floor, on the carpet, on their backs to look at the underside of this hologram that is laying as if on an examination table. And on the bottom, these students are benefiting from the magnification tool. Off to the right is a teal circle that students or faculty can place over a hologram, in this case, one of the lungs, and blown up in a sphere is a zoomed in detection of that hologram. And so these students are on the floor enjoying learning more about the circulatory system. So that was the wow factor for the students. But even long before these students had their first exposure to the Neuroanatomy Suite from Alencia XR, I had my own experience that I want to share from the educator's perspective. And that is when I put on the lens, the headset, and looked to see the details, hear what I'm showing of different cross sections through the brain stem, and the detailed axons of the cortical spinal tract, which is a motor pathway sending information from the brain to the cord. I was agape. I literally gasped out loud and went, oh my. I've summed this up since saying that what I saw before me was the very thing that had been in my mind's eye since I became an expert in neuroanatomy. The very thing that had been missing from my instruction of neuroanatomy, and that is no exaggeration. I have taught neuroanatomy over a decade, and every few years I've tried to conjure up how might I turn what is the truth of neuroanatomy into an interactive 3D method for students. And so as I would struggle with styrofoam dinner plates, trying to puncture and thread yarn through these to represent the brainstem, I gave up. It was just too frustrating, not scalable, and not practical for the time of the laboratory session. This is that tool that I was looking for. Why? It's not only showing in 2D form, like perhaps a textbook would, but when you are using it live, you can walk 360 around the hologram and notice the features that at each given cross-section of the brainstem, for example, you can see how these fibers move along the X or Y planes. For example, this orange and yellow axons through the cerebral peduncles at a very lateral section or location on the brainstem. This then becomes a more anterior location and even indicates the decussation of the pyramids, where information from the right side of the brain crosses to the left spinal cord, which is a very complicated concept for students of neuroanatomy to understand. Less so, of course, when they are able to interact in such a beautiful way. So now we're into the detecting phase, the second step of the laboratory session, where the faculty and audiovisual team use the HoloAnatomy Neuro Dashboard. So remember, we started with a designer before lab. During lab, we've opened the dashboard, which is basically a status report of where we are in the laboratory session. Notice on the far right is the slide navigation. Each row is the name of the slides that are in the slide deck that students will progress through. And so I can see that we are starting on the first of 7 slides. To the left is each row is listing a different lens or headset that is active in the room. So here we have just one listed, but you can imagine during a lab session of 50 students, this panel being filled with 50 green rows. Should one of those rows turn red, it's the indicator that a student has either dropped out of this software file session or some other reason that the AV team can respond to that student and help them finding their number. This is if we all wanted to progress through the holograms at the same pace, all 50 of us at the same time. It's also possible that each pod can progress through the slides at their own pace, so there's quite a bit of flexibility. Now we're at the final discover neuroanatomy. I'm going to walk us all through the 4 different laboratory sessions that we have created in these last 2 years, and we're always adding more. So during the introduction to the central nervous system, students are presented with, and this is what I've decided, you can do as you wish, but I started with the right cerebral hemisphere in teal. Beneath it in brown is the cerebellum and the brain stem. Notice there's different rainbow colored structures, anywhere from the yellow olfactory nerve, that's cranial nerve 1, and you can see some other rainbow structures peeking out from underneath. Those are the enticement for students to lean their head in and through this right cerebral hemisphere as the outer layers of the hemisphere peel away and reveal the internal structures of the diencephalon and other structures of the brain. The notice yellow arcing structure is the corpus callosum, which is easily distinguishable from the purple ventricle, the right lateral ventricle, and even distinguished from the arcing red fornix. And so I'm pointing out that because we can designate different colors for each of these adjacent structures, it's easier for students to distinguish them. That's one feature that I enjoy, is the efficiency with which I'm able to teach neuroanatomy. What I also love is how true to anatomical structure it is. Notice that the yellow corpus callosum almost looks striped. This is, in fact, the way it really is. The striping is to indicate that the axons of these neurons are connecting left and right hemispheres. And this is the function of the corpus callosum. So we can extend the conversation from just anatomy into function of that anatomy. And students, as they walk 360 degrees around this structure, can see, for example, that I, as the faculty member, have purposely indicated for the right cerebral hemisphere to be opaque, whereas the left cerebral hemisphere on your right as the viewer is translucent, and students can see these same rainbow structures without putting their head deep into the hemisphere. So these are 2 different ways to learn. All right, this was lab example 1. Let's move on to example lab 2, where we focused on those motor pathways that gave me my own personal wow movement and moment. Here is an example, a back large view of the hologram before students as they're learning the cortical spinal pathway. Notice that I've purposely made in teal a translucent 2 cerebral hemispheres, because I want students to see the large cell bodies that originate in the motor homunculus of each of these cerebral hemispheres, and their long axons that extend for feet in distance down through the internal capsule, the insides of the cerebral hemispheres, traversing the brain stem and traversing the spinal cord to the level of the spinal cord where this axon synapses and then exits the spinal cord via a second motor neuron, the lower motor neuron, to communicate to muscles of the body. Notice that in the background, I can purposely add other files to indicate specifics about this pathway that I want to be at the forefront of that slide's lesson. Here, I have taken a snapshot of what it might look like for the student to lean in and see any given cross-section of the brainstem. It's just beautiful because one of the tasks of a student in neuroanatomy is to be able to identify that, for example, this top cross-section is from the midbrain versus the pons versus the medulla oblongata regions of the brainstem. Here they are in context, whereas otherwise they might be out of context. notice that some structures, for example, this green structure, can appear at every level of the brainstem, indicating how it moves from a more lateral to medial position. These colors are indicating the tracks or the highways of axons as they traverse the brainstem. And I can then toggle on or off, as I've shown before, the orange and yellow lines of the cortical spinal tract, the motor pathway that traverses from the brain to the spinal cord, just beautifully showing, for example, if you're a fellow neuroanatomist with me, that the lateral cortical spinal tract is that portion of the tract that decussates or crosses from left to right and right to left, but that the anterior cortical spinal tract does not cross at this level of the brainstem and remains ipsilateral. That becomes a reality when students can see this visually in 3D, walking 360 around the hologram. The counterpart to the motor pathways, which is information from the brain to the body, is sensory information coming from our body to the brain. Here's one way that students have interacted with these holograms, either sitting and looking from a distance, kneeling closely, all the while discussing as a group and looking at the panels of information at the back to compare and contrast. Here again is a viewing closer up, showing again the cross sections through the brainstem. Now, rather than showing the motor pathway that was designated in the orange and yellow color, this is the medial lemniscal pathway, the dorsal column medial lemniscal pathway designated in purple. All right. What I want to show here specifically, and then tell you a bit more about, is one confusing concept to students about these sensory pathways is that there are multiple sensory pathways from the body to the brain. For example, the sensation of pain and temperature that you would have from your fingers. Ouch, you've touched the stove and you're jumping back from that pain of the hot temperature. That travels along a tract or a highway called the spinal thalamic tract. That tract, once it enters the spinal cord, crosses sides of the body immediately. But this that I've shown on the screen in purple, this is the fine touch, as if we were to read Braille, the bumps of the Braille language, and proprioception, knowing where our limbs are in space. These two sensory aspects travel a different highway called the dorsal column medial lemniscal tract. It ascends the entire spinal cord on the side of the body from which it originated, and finally decides at the level of the brainstem to cross sides. This is key for students of neurology and neuroanatomy to understand. The HoloAnatomy Neuro Suite allows me to have students visualize that up front and center. And it allows me to have some fun specifically, meaning I, during lecture session, will help students learn this differentiating pathways of the two tracks by singing to them. And once we reach this laboratory session, I sing to them once again, reminding them of what we've learned and helping them follow the path. And so for the fun of it, I'm going to sing to you now. So you can follow along to these words as you listen. I make the songs always to some familiar tune for most of the students. This one to "Oh My Darling." But notice that the two stanzas or the two verses are about respective tracks. So let's learn about spinal thalamic and then medial lemniscal. Spinal thalamic crosses right away in anterior wide commissure. It ascends in lateral funiculus on its way to thalamus. Medial lemniscal crosses later in internal arcuate. It ascended posterior funiculus on its way to thalamus. And of course, I enjoy being silly in this way, but I've had students who have since graduated from schools at which I've taught previously that will email and say, I finally made it out of residency. Thank you, Dr. Jeter. And I remember those songs that you sang to us. And that gives me great personal delight. So thanks for letting me sing to you as well. The fourth and final laboratory session I want to share with you is that about cranial nerves and the brainstem. Cranial nerves extend from the brainstem, and so I first orient students to the brainstem, but they emerge from different levels, from caudal to rostral out of this brainstem, and different areas from medial to lateral. That's something that they can learn well. But these photographs are showing you even deep inside the brainstem itself, where are the nuclei or the cell bodies of those cranial nerves as they extend. What I'm wanting to show you is that in the bottom right-hand corner, I've chosen an image that we have talked about during lecture to indicate the rostral caudal location of where this structure occurs. And the colors can be aligned for these brainstem structures. All right, so we've covered and shown pictures of the 4 different laboratory sessions that Kansas COM has used to date. I want to share a bit of what we've learned from first to second iterations of this course, the 2 academic years. In the first academic year, students would listen to me teach them while talking to them over the microphone that could be heard over the sound system of this anatomy lab room. What is fun is that everyone kind of thought, well, this is a soothing voice, but we're kind of tired of hearing you, Dr. Jeter, talk to us for hours, including the lecture session that preceded the lab. We want to be more interactive with each other. And I very much agreed, even from a pedagogical standpoint. So you'll notice here listed on the slide that we added group learning without faculty narration. What I mean by that is in advance, during that design phase for the laboratory session, I created a physical worksheet that asked students questions. Please, as a group, view the hologram and answer these worksheet questions as it guides students through the concepts and learning objectives of that laboratory session. Change is fast for us at Kansas COM because even mid-course, we converted that physical paper worksheet to be an app that students could access on their personal devices. And so instead of standing with clipboards, pens, and paper, they could stand with their smartphone and answer the questions through the app, all of which then appears in the cloud for me to view on a spreadsheet should I want to know more about their progress. And what's wonderful is each small group of students, which is usually a group of 5 to 7 per pod, these students could advance at their own pace, one of those pod students being designated as the leader in the HoloAnatomy Neuro software so that they could advance through the series of hologram slides. Perhaps one benefit to having this technology that I didn't fully appreciate until we got underway is how it is a tool that amazes everyone that comes to visit our campus and is a way to have community outreach about anatomy education. You'll notice these 2 ladies in the upper left-hand corner are physical therapists from a community nonprofit that provides exercise specifically for patients with Parkinson's disease. And so they could come and see the technologies our medical school uses. To the right is a gentleman who is an educator from a nearby community college that is amazed to see the advancements in anatomy education. And at the bottom are some students that you've seen before, but they are from a high school in their specific anatomy and physiology course and program as pre-health. So I thank you for being an attentive audience, I trust, listening to my tips, experiences, and singing. I want to say thank you to Alencia XR for inviting me, and I'd love to spend the remainder of our time answering your questions and getting us all excited about the digital tools available to us.
Oh, thank you so much, Dr. Jeter. Every time I spend with you, I learn a little bit more. I don't think I'm ready to be a doctor quite yet, but maybe a few more webinars. And I'm really glad you mentioned the singing, and it's one of the things we talked about. Maybe just expand a little bit as we go to Q&A. Is the reinforcement that you talked earlier about the singing and the connections that are there, as well as being able to immerse yourself and actually see those connections. It sounds like that's having a good impact.
Yes, and I'll say that I'm wanting to show the students not only neuroanatomy, but the way that cognition works, just to that point, that if we can link new information to past information, namely in the tune of a familiar song, it makes it fun and more salient, and students will remember it longer.
Excellent. Excellent. And now I know also the next time I burn myself on the stove, which I do once too often, I'm going to drop into the HoloAnatomy Neuro Suite app and understand what I just did. Great. We can move on to the next piece is on Q&A. And Adam, do you have any questions from the audience that we'd like to table?
I do. I actually have a few questions that came in. But first of all, I'd like to say wonderful presentation. Soon coming out is going to be HoloAnatomy at Broadway featuring Dr. Cameron Jeter. And let's get down to the questions here. So we have one from Krishna Sharma that says, great presentation and an exciting tool for enhancing the neuroanatomy learning experience for medical students. Is it possible to incorporate clinical neuroanatomy, such as explaining injuries to CSD axons and their consequences into the teaching approach?
Krishna, thank you for your question, because I'd say many of us are in health professions institutions, and the reason we have anatomy as its foundation is to be better clinicians in providing that care. So I'll say yes. You notice that for each slide that included a hologram, in the background, you could load up to 2 images that appear vertically behind the hologram. I didn't show here, but that's where you can upload CT images, MRI, X-rays, and so students are able to relate those radiological images not only to each other, if you choose to upload a normal and diseased CT scan, for example, but relate it to the anatomy of the hologram itself.
Wonderful, thank you. Hope that answered your question, Krishna, and you can always ask us anytime you'd like if you'd like us to expand on that. In your experience, have you noticed any participants experiencing nausea while using the program?
Thank you. This is often a wonder and worry of new students to the program. I would not say it goes as far as nausea, but there are some students that say, you know, I can only handle maybe 20 minutes at a time, and then I would like to take a break. And this is very feasible. So I've already mentioned that we have our anatomy lab designed in 50-minute segments. I designed the HoloAnatomy Neuro slide deck to take a subset of that, maybe 30 to 40 minutes, because there's always the setup and takedown of students departing the lab. Within that 30 to 40 minutes, because each pod progresses at its own pace, the students in that pod can decide how quickly or slowly they progress. If a student decides they have a headache and want to take a break, there are probably 2 different ways they can do this. One, the lens on the headset actually flips up, and so that takes them out of the augmented reality experience without removing the headset. Or secondarily, they can remove the headset. Yeah.
Fantastic.
And I'll even say that's maybe 5% of my students, 10% that I've experienced. It is a small minority.
And just to build on that, it's one of the distinguishing factors that I've seen in my experience through mixed reality is that because you're able to still ground yourself in the real world, we're seeing less evidence of that nausea as opposed to virtual reality, which has had issues. But thank you very much for the question.
Sean, thanks for saying that, because let me designate for folks who are unfamiliar with this, that there's a slight difference between virtual reality and augmented reality. Virtual reality headsets do not let you see the real world outside the headset. You are, in a sense, for better or worse, imprisoned in that virtual world. Augmented reality, that is the case here for HoloAnatomy Neuro, it's almost looking through sunglasses. You still see the carpet of the room, your classmates, the walls, but the addition of the hologram before you. And so there's less orientation or disorientation problems.
Great points. Adam, do we have another question?
Of course. Give me one moment. The next question here is, do you think visualizing actual CT MRI data will make the learning better? And that is from P. Harry Haran.
All right. Thank you, Mr. or Dr. Haran, which is, yes, of course. As I mentioned earlier, that is often the end goal of anatomy education within the fields of health professions, is to get the student first to know the anatomy and then to apply it to clinical scenarios. And so we, not only through this HoloAnatomy Neuro Suite, but through other digital platforms we have to augment HoloAnatomy Neuro, present these images to students alongside the hologram. So for example, those vertical views of figures could be, as I mentioned, a CT or MRI scan. And it is in other platforms that they could then scroll through the 3D depth of those images as they relate them. We have a radiologist faculty member on staff who attends our laboratory sessions on those days to give the clinical relevance.
Wonderful. So I have a question here about the limited field of view. Has that been an issue for you?
All right, so I am presuming what this person is indicating is that when you put on the headset, you, as I mentioned, can see the room around you, but the hologram is apparent to you in almost a rectangular field of view. And so you have to orient your head at the right up, down to get the entire height of the hologram. I would say in the first maybe 1 or 2 times of using the headset, it was, I was getting used to only being able to see a portion of my field of view. But very quickly by session 3 and onward, I almost forget that that's the case. And this is why for our first year incoming medical students, we actually have a series of laboratory sessions where they are learning each of the types of technology at KansasCom. So when they reach, for example, the course on the musculoskeletal system, those sort of acclimation, calibration considerations are a thing of the past.
Excellent. And I can see our time's getting close as we have time for one more question that's come up a couple of times. And Dr. Jeter, do you think this technology will actually benefit programs beyond those that strictly focus on neuroanatomy?
Yes, I love it. Thanks for this question. I'm kind of laughing and smiling because I've mentioned I'm at an osteopathic medical school. Not only is medicine based heavily on anatomy, but osteopathic medicine specifically that involves hands-on therapy on the patient requires the clinician to have a deep understanding of anatomy, not only cognitively, but kinesthetically through their hands. Therefore, one of our osteopathic faculty who has a DO degree as well as being a chiropractor loves anatomy, and we have been in discussions about using this neuroanatomy software suite for his osteopathic manipulative methods course, where they learn for 1 hour of their lab these techniques as students are working with each other on patient treatment tables. And the other half of those lab students are down in the anatomy lab learning just-in-time anatomy and neuroanatomy for the methods of their osteopathic course.
it resonates so well with some of the discussions that we've had at Alencia XR, and that there's other programs, and just throwing one out, dentistry, for example, where we need to understand the central nervous system impacted of other things going on, even kinesiology. And then we're also having a lot of more discussions in the commercial space, in medical devices, and understanding how in central nervous system or in the anatomy, it's actually impacting when it's implemented. So thank you so much for that. I can tell, and you and I have discussed this quite a bit, we could spend another hour discussing this and taking questions from the audience. I can tell I need to move on. So I'll just get you to advance past the Q&A slide that we just finished. And I'll just close with a few words and kind of next steps. Upcoming in the next series, we actually have Professor Christine Parker on November 20th, and she's going to share how anatomy education was transformed using HoloAnatomy Suite at Finger Lakes Community College. So I invite you to welcome there. We'll make sure you have the link in the follow-up and communications. And then in terms, and that's actually, thank you, Adam, for dropping that into the webinar chat as well. You can sign up right away. And moving on to the next slide, just a few next steps that I wanted to share with you as we close. We've just scratched the surface on today on these solutions and the impact, and I'm sure you're going to want to go deeper and reflect on the conversation that we've had today. And so we already covered the registration on the next website. There's also some recorded sites that you can see on our website in the events area that you might want to take a look at as well, and really just take a look at the other stories that we have, just exposing the value and the impact that we're seeing. And ultimately contact us when you're particularly looking to make that next step. And I'll just recap with a huge thank you. First, final thank you to Dr. Cameron Jeter. It is absolute pleasure, and thank you for sharing the insights and the drive for innovation that you've had. So I really appreciate that. And I also want to thank the audience for hanging in with us and really challenge yourself to reimagine how could I use technology to actually drive better learning outcomes and ultimately better equip people in the medical field. So I really appreciate that. Just a few points on when we look at XR technology, it's accelerating at an incredible rate, and it's establishing itself in academic, really at an early stage, really even in the middle and even in primary, we're seeing more learners actually leverage this technology. So they're coming into the fields expecting this technology. And so why is that? Well, it's the impact that we were talking about, the measured impact that we're actually seeing. So when you combine those two, that's something that's going to continue to accelerate. It changes so fast. We did a little bit of reflection, and I think we have over 70 years of XR experience in Alencia XR. So I'd encourage you to partner with us to figure out what that roadmap looks for your institution or your organization. So feel free to reach out to us. At the close of this webinar, you're going to receive a survey after it ends. It'll pop right up. Please give us your feedback, any suggestions, any questions that we weren't able to address as we ran out of time. You'll also be receiving emails in the upcoming days to make sure that you have access to the content and any other things you can consider. And so I'd just like to finish by thanking everyone. And again, Dr. Jeters, I look forward to continuing the conversation.